Now, the another approach is intragastric floating gastrointestinal drug delivery system. In this system, there is a presence of floating chamber, microporous wall is there, and the drug reservoir. So, in this system, the drug reservoir is encapsulated inside a microporous compartment. So, system can be flowed by floating chamber. As you can see here in the diagram, a floating chamber is present, which may be vacuum or filled with air or harmless gas. So with this, it comes on the floating. Now, the another approach is gastrodynamically balanced system. It is prepared by incorporating a high level gel forming hydrochlorides in the percentage of 20 to 75% weight by weight, and the various polymers can be used, for example HPL, HPMC, sodium CMC, that is carboxyl methyl cellulose, hydroxyethyl cellulose, hydroxypropyl cellulose. So all these polymers can be used, and then it compresses these granules into tablets or capsules. This system maintains the bulk density less than 1. So that's why it comes under floating system. Another approach is raft forming. This system is used for delivery of antacids and drug delivery of for treatment of gastrointestinal infections and disorders. This mechanism involved in this system include the formation of a viscous cohesive gel in contact with the gastric fluid, and it will form a continuous layer that is called as raft. See here, as you can see in the diagram also, there is the formation of raft, that is a continuous layer, viscous cohesive layer of a gel. Now another approach is hollow microspheres. For this, various polymers are used, for example polycarbonate, cellulose acetate, calcium alginate, Utrazid S, agar, etc. So the mechanism is shown as in the figure. See, oil by water emulsion is there. There is a rapid diffusion of dichloromethane, then slow diffusion of ethanol, and hollow microsphere or balloon is prepared, which is having low density, so it will easily float. Now, the another approach is alginate beads. It is prepared by dropping sodium alginate solution into the aqueous solution of calcium chloride, which causes the precipitation of calcium alginate. So, after the formation of these alginates, it is freeze dried in -40 degree temperature for 22 hours. Talking about its appearance, it is it is beaded in nature, and the shape is spherical, and the diameter is 2.5 mm. It is not necessary that the diameter will be 2.5 mm only. Like it varies, because whatever the instrument, whatever the apparatus we are using to that for the dropping, the size of that dropper is defines the size of the particular alginate beads. Another approach is superporous hydrogels. So these are swellable gels. So in these gels, a swellable agent is incorporated so that it gets swell and comes on the floating. Swellable agents have pore range ranging between 10 nanometer to 10 micrometer. Superporous hydrogels will swell more than the swelling ratio 100. This is achieved by co-formation of a hydrophilic particulate material and ACDI sol, that is cross carmylose. Now, the another approach is expandable system. In this, swellable system is considered. The swelling is usually results from osmotic absorption of water. The water get absorbed inside the particular formulation. The device gradually decreases in volume and rigidity as a result, depletion of drug and expanding agent or bioerosion of polymer layer, enabling its elimination. Now, the another system is mucoadhesive systems. The basic of mucoadhesion is that a dosage form can stick to the mucosal surface area. And see, this mucoadhesive systems is very much important in case of stomach cancer. See what is happening in stomach cancer. Like a person is suffering from stomach cancer, obviously it will be in the stomach. So if we are preparing a gastroretentive drug delivery system which is based on the mucoadhesion, so the formulation will get stick to the site of stomach cancer, so and releases the drug at that particular site, so it will enhance the results. There are some common examples of materials that are used for bioadhesion, or we can say mucoadhesion, that is polyacrylic acid, carbopol, chitosan, polymethyl vinyl ether, sodium alginate, tragagen. So all these can be used in the formulation of mucoadhesive system. Now another system is magnetic system. It is based upon the principle that a dosage form contains a small internal magnet, and also a magnet needs to be placed inside the abdomen over the position of the stomach, so it will enhance the gastric retention time. Now just talking about the brief intro about the evaluation of gastroretentive drug delivery system. So there are several tests. Pre-compression test includes size and shape of that particular formulation, particle size, density, flow property. Post-compression test includes thickness, hardness, floating time, dissolution test, etc. In vitro test includes floating lag time, dissolution study, swelling index, mucoadhesiveness test, which can be done by texture analyzer. Swelling test. In vivo test includes radiology, scintigraphy, gastroscopy, ultrasonography, magnetic marker monitoring. So in case of in vivo, what we have to do? We just have to incorporate our drug, and drug can include some magnetic markers or some UV markers, so that when we are giving it to a particular animal like mouse, so in case when we are doing some test, so it will directly show. We can do X-ray also by incorporating a fluorescent molecule, so it will give its images. Talking about the applications, it enhances bioavailability. Sustained drug delivery system can be achievable. Site specific drug delivery system, absorption enhancement, minimized adverse activity at the colon, reduced fluctuation of drug concentration. These are some marketed products for gastroretentive drug delivery system which are already present in the market, like wall release. The drug delivery system is floating capsule. The drug is diazepam. So it is manufactured by USA. So here you can see there are several other examples are also given. So you can see here in the delivery system, all are floating approaches. As I told you earlier also, that high density system is not yet available in the market, but the low density, that is floating drug delivery systems, are already present in the market. So conclusion, gastroretentive drug delivery system technologies have been extensively explored in recent